Oh, good morning, Samuel. I'm Wendy. I'm the nurse looking after you today. I see that your secretions are blocking your airway a little bit and you're struggling to breathe. Your saturations have dropped below your target range. So I'd like to do some nasopharyngeal suctioning on you, if that's okay. It's just going to put a little thin, flexible tube into your nostril and we'll suck away all those secretions to help you breathe more easily. Is that all right?
Okay.
Lovely. Okay, so I'm going to need you to sit in a semi-upright position. I'm going to support your head and neck with a pillow to ensure that your head doesn't tilt forward or backwards. It's in a neutral position. I'm going to check my oxygen and my suction are working, which they are. Now, Samuel, this is quite an uncomfortable procedure, can be uncomfortable. So if at any point you want me to stop, just raise your hand as a signal and I will stop immediately, okay? I'm going to get you to do a sniff test. So if you take a finger, block one nostril and sniff, and do the same on the other side. Which side feels clearer? The right side. Okay, so we'll use the right side, and I can see there's no deviated septum or anything like that, so I'm happy to use the right side. So, Assessor, during the procedure, I will be monitoring Samuel's colour, secretions. I will monitor his breathing rate, breathing pattern, and heart rate. I will watch for any signs of trauma or distress, and I'm going to use the baseline observations as my guide. Okay, Samuel, I'll just get my equipment. I'll be back with you in a moment. So before I touch any equipment, I'm going to do my hand hygiene. It's clean, dry and intact and expires on 05/28. Do my hand hygiene according to WHO standards. For 30 seconds and allow to dry for 30 seconds. So I'm going to get my equipment. I need some sterile water here. This expires 05/25 and it's clean and ready to use. This is my tender tip. Catheter, thank you. This is my tender tip catheter. It is a size 10 for adults. It's clean, dry and intact and expires on 03/2025, so it's safe for me to use. I'm going to need my PPE that has already all been pre-validated. I need a face mask, already validated. Goggles, already validated. And my gloves. I will assemble my equipment using a non-touch technique, protecting key parts. And make sure that the catheter tip doesn't touch anything but my gloves and Samuel's nostrils. Okay, so I'm just going to lubricate 15 to 20 centimetres. Okay. And turn it on. It needs to be between 100 and 150 for an adult, so I'm going to set it to 120. Okay, you ready, Samuel? I need you to inhale. So as I go in, I'm going to go in until I feel some resistance or patient starts coughing, and I would withdraw 1 centimetre before applying continuous suction and swiftly withdraw. And I could try this up to 2 times, so I'm going to go one more time. Inhale for me. I feel the resistance, so withdraw 1 centimetre and apply suction as I come out. Okay, we're all done. So I would just flush the tubing. I would make sure Samuel's face is clean. I would discard all the tubing into the clinical waste. along with my gloves. That can be used for next time. My mask, my apron, hand hygiene. Okay, Samuel, how's that feeling? Are you comfortable? Yes. I'm going to leave you with the call bell, and I'll be back very shortly to make sure that your oxygen saturations have come back to normal levels by doing another set of observations. Okay, are you comfortable? Yes. Lovely, thank you.